Future nurses, if the only pulse point you know is the apical pulse and the brachial pulse, come closer. Let's talk about these 10 pulse points. We're going to talk about their location and what they are used for. Now let's go. The first pulse point to talk about is the temporal pulse. This is located on side of the forehead above the zygomatic bone, which is the temple. It is used to assess circulation to the head and used in children during CPR. Okay, the next pulse point is carotid pulse. This is located on the side of the neck beside the trachea. It is best for assessing circulation to the brain, and it is preferred during adult CPR. Nursing consideration: check one side at a time. Pressing both at the same time can cut off blood flow to the brain. The next one is apical pulse. This is located at the 5th intercostal space, mid-clavicular line, which is the apex of the heart. This is the most accurate heart rate. It is used for infants, irregular rhythms, or before giving digoxin and beta blockers. You assess this for 1 full minute before giving these medications. The next one is brachial pulse. It is located in the inner arm above the elbow crease, used for blood pressure measurements and infant CPR. The next one is radial pulse, which is located on the thumb side of the wrist. It is commonly used for routine pulse check in adults. And for radial pulse, you count for 30 seconds and multiply by 2 if the pulse rate is regular. But if the pulse rate is not regular, you count for 1 full minute. The next one is ulnar pulse. It is located on the little finger side of the wrist. It is used to assess circulation to the hand along with the radial pulse. Now the next one is femoral pulse. It is located in the groin crease, midway between pubis and hip bone. It is used to check circulation to the legs, also used in shock or cardiac arrest. The next one is popliteal pulse. This is located behind the knee, and it is used to assess circulation to the lower leg. Now it is the hardest pulse to palpate, so use both hands and bend knee slightly. The next one is posterior tibial pulse. It is located behind the inner ankle bone, and it is used to check circulation to the foot. Nursing consideration or anklet tip. It is good for diabetic foot check. And the very last one, guys, dorsalis pedis pulse. It is located on the top of the foot, lateral to the big toe tendon, and it is used to assess circulation to the foot. And anklet tip, it is hard to feel, so sometimes you can use Doppler. Future nurses, let's talk about these 5 temperature routes you should know as a nursing student. The first route is oral route. Now this is when the digital thermometer is placed under the tongue and mouth is closed. Now the pros of this temperature route is it is easy, non-invasive, and accurate if done right. The cons of this temperature route is it is affected by eating, drinking, smoking, or talking. So you will not get accurate reading if any of this is happening. And it is not for unconscious patients, confused patients, or young kids. Anklet tip, you have to wait 15 to 30 minutes after eating or drinking, okay, before taking the temperature through the oral route. The next one is rectal route. Now this is when lubricated thermometer is inserted into the rectum, about 2 to 3 centimeters in adults and 1.5 centimeters in infants. Pros of rectal temperature route is it is very accurate, core temperature. And the cons of this temperature route is it is invasive. You can imagine thermometer in a rectum. It is very invasive. It is also uncomfortable, and there is can lead to risk of perforation, and it is contraindicated in rectal surgery. Okay. The next one is axillary route. This is when the thermometer is placed under the armpits and arm held down. Okay. The pros of this route is it is safe, not invasive, and it is good for kids and infants. The cons of this route is it is less accurate. Next one is tympanic, in the ear. Thermometer probe is inserted in the ear canal. The pros of this route is it is quick, convenient, and non-invasive. It can be inaccurate if there's ear infection, wax, or improper placement. So to take the temperature, you pull the ear up and back for adults and down and back for kids under 3 years old. And the very last one is temporal route, which is the forehead. Now the thermometer is scanned across the forehead over the temporal artery. Pros of this route is it's quick, easy, non-invasive, and good for kids. The cons of this route is it is affected by sweat, air, and room temperature. So tip for taking this: place probe flat on the skin, not over the air. Now I hope you know your temperature route.